Hi there, everybody. We're going to talk about the language that we use in anatomy and physiology. A lot of times I hear my students say, I'm learning a new language. Well, you do, because anatomy and physiology has specific language associated with different body parts. And the reason for this is so that people don't get confused. If you were to call somebody up and say, oh my gosh, say you were babysitting somebody's child and you said, hey, your child just got a burn on his wrist. The parent may not understand where that is. And the reason for that is you could have a burn on the wrist here or a burn on the wrist over here. They're different parts of the wrist, but they're both the wrist. And so using specific terms helps us to identify exactly where the damage has occurred. And so we have terminology for position, body position, direction, so where something is associated with different body parts. We have regions, and then we have anatomical structures that we'll talk about. So anytime you are dealing with anatomical terminology, you want to assume whoever or whatever you're talking about is in the anatomical position. Anatomical position is standing erect. Your feet are going to be facing forward. The palms of your hand are facing forward, and your head is facing forward. Everything is perfectly straight otherwise, right? Arms down at the side, legs standing up straight, everything. Now, if you're working in a doctor's office, if you're working in a hospital, if you're working with patients of any type, you're not going to have the patient stand like this while you're assessing them. You have to assume this and then accept that that's not going to be the way they look. So terminology, directional terms help us to identify the location of certain things. There are a lot of different terms. So in this class, superior will be used. You could also use cranial or cephalic, but I typically use superior, which means towards the head. So the forehead is superior to the nose, which makes sense. Inferior, you could also use the term caudal, but I typically use just inferior, away from the head. And so in this case, you could say the nose is inferior, the forehead, or the navel is inferior, the breastbone. Anterior and ventral, I use those interchangeably, so I use them about the same amount, towards the front of the body. And the breastbone is anterior, the spine. Posterior or dorsal, I also use those two interchangeably. Towards the back side of the body. So the heart is posterior to the breastbone. Medial means towards the midline of the body. The heart is medial, the arms. Lateral, away from the midline of the body. So the arms are lateral, the heart, or the chest. Intermediate would be more medial, between a more medial and a more lateral structure. So you might say the collarbone is intermediate, the breastbone and the shoulder. It's in between. Proximal and distal. Proximal is closer to the point of attachment to the limb or to the trunk of the body. Of a limb to the trunk of the body, sorry. And distal is farther away from the point of attachment of a limb to the trunk of the body. So whenever you use the terms proximal and distal, you're dealing with the arms and legs or the appendages. I always remember appendage has a P and a D, proximal and distal, P and D. So the elbow is proximal, the wrist. but the elbow is distal, the shoulder. Make sense? Superficial is towards the surface of the body or external, and deep is away from the surface of the body or more internal. So skin is superficial, the skeleton, but lungs are deep to the rib cage. We also have regional body terms. So if it's on the anterior side, then it's an anterior or ventral body landmarks. And we have a lot of these. You need to know all of these. So I'm not going to go through every single term. Frontal means forehead, orbital means eye. You need to go through, and I would make up note cards for all of these terms and then memorize them. So you know if I'm talking about the hand, you know it, manus and hand are the same. Finger and digit are the same. Here's the posterior body regions. Again, we have a lot of the same. If you look anterior, we have brachial right here. And then we have antebrachial. And on the posterior, we still have antebrachial and brachial. But the elbow, old cranial, the front of the elbow is called antecubital. So there are certain terms that are specific to anterior or posterior aspect of the body. Make sure you know all of these terms. It's very important. And it will help you in future chapters as well. Planes and sections. So a section is a cut along a line of the body, and the lines of the body are known as planes. There are basically three major planes that we talk about, but there are others as well that we sometimes use. So sagittal section divides the body into right and left halves, and this can go anywhere. If you are dividing the body right down the middle, that would be a mid-sagittal. That would be an equal amount for the body, or you could divide an organ into equal right and left parts. A frontal or coronal plane is one that divides the body into an anterior and a posterior part. And then a transverse or cross section divides the body into a superior and inferior part. So here is a sagittal, or this one is actually a mid-sagittal or median plane. Here is a coronal or frontal section that divides it into an anterior and posterior. And here is a transverse section or cross section, producing the superior and inferior parts of the body. So we have two major cavities that we typically talk about. We have a dorsal body cavity and then ventral body cavity, and these can be separated into multiple body cavities within those two areas. So in the dorsal body cavity, we have the cranial cavity and the spinal cavity. In the ventral body cavity, we have the thoracic cavity, the abdominal cavity, the pelvic cavity, and oftentimes the abdominal and pelvic cavity are put together, called the abdominal pelvic cavity. So the cranial cavity houses the brain and has protection of the skull cap to protect that soft tissue. The spinal cavity also has bone protecting it. Spinal cavity houses the spinal cord and is protected by the vertebrae. So cranial and spinal cavities are allow the brain and spinal cord to attach together. Then we have the ventral cavity has the thoracic and then the abdominal pelvic cavity, which you just saw. Thoracic cavity is superior to the diaphragm. The diaphragm actually separates the thoracic and the abdominal pelvic cavity. The thoracic cavity houses our lungs, our heart, and some other structures like our esophagus and trachea. And then they are protected by the rib cage, which makes up or which protects all of those soft organs. Abdominal pelvic cavity is inferior to the diaphragm, and it doesn't have as many bones protecting it, but it does have a lot of muscles surrounding the cavity itself. The superior aspect of the abdominal pelvic cavity, also known as the abdominal cavity, houses our stomach, our liver, our kidneys, as well as some other organs, intestines. The inferior then contains a lot of our reproductive organs, our bladder, rectum, intestines again, and does have a little bit more protection than the abdominal cavity in that we have the pelvis, the pelvic bones do protect a little bit. The abdominal pelvic cavity is often divided into 4 quadrants and 9 regions. It's a very large structure, and when you think about the saying, I have a stomach ache. So when you think about the stomach and a stomach ache, you're probably not actually discussing the stomach and pain in the stomach, and I'll show you why in just a second, okay? So the 4 quadrants, we have a right upper, a left upper, a left lower, and a right lower quadrant. Here is the stomach, right here, which is pretty high up. It's right under, our ribs are there. So unless you have pain up under your rib in the left upper quadrant, you're probably not actually complaining about your stomach. Most people, when they say their stomach hurts, it's actually your intestines that are probably causing pain. Even easier to pinpoint damage is separating them into the 9 abdominal pelvic regions. So here we have a hypochondriac right and left. We have a lumbar right and left, and an iliac or inguinal right and left. Down the middle, we have the epigastric, the umbilical, and then the hypogastric. And if you look over here, you can see the stomach is found in the epigastric and the left hypochondriac region. The liver is found in the right hypochondriac and the epigastric region. You have the gallbladder found in mainly the right hypochondriac region. We have intestines, large intestines, found in the right iliac all the way around the right lumbar, umbilical, left lumbar, left iliac, and the hypogastric. And then you have the small intestines right in the middle that's kind of found all throughout this area. Your kidneys are going to be found in the right and left lumbar regions. Your bladder right here is found in that hypogastric region. I'm telling you this because a lot of times I'll ask you if there's damage to one of these regions, what organ may have been damaged. So it's always good to know. We have other body cavities that we don't typically really focus on, especially in chapter 1. But some of these are your oral cavity, your nasal cavity, your orbital, so your eye cavities, and your ear cavities. So at this point, you can now go through and answer questions 10 through 12 on the study guide. All the anatomical terminology, the planes of the body, the different cavities, Also get comfortable with the 9 abdominal pelvic cavity regions because you will be expected to know them and know organs found in each, which I did tell you some. I'm going to stop here and we'll go through homeostasis in the next video.